Atul Verma and Mike Gibson coming to you live from ACC 2023, and we're talking about the PULSED AF trial. Talk to us a little bit about what you did.
Yeah, so thanks very much, Mike. Pulse field ablation is a new type of ablation. It's different from thermal ablation by radiofrequency or cryothermy. It delivers electrical pulses to the tissue, and by doing so, it may be safer and cause less collateral damage than thermal ablation. It's going to be much faster, and that's what we were also hoping to show. And the question is, what was the efficacy going to be? Was it going to be similar to thermal ablation, or was it going to be better? And so that was really the purpose of the PULSED AF pivotal trial, was to assess a new pulse field system, the Pulse Select system.
I'm sure it's randomized. How many patients? And who were the patients?
So this was not a randomized trial. This was a dual cohort prospective trial with paroxysmal and persistent AF patients, with 150 patients in each group. And it was a global trial. So this happened all across the world: Asia, US, Canada, Europe, Australia, with more than 60 different operators.
So quite a spread in location, systems of care, and operator experience. And what did you find?
Well, first and foremost, we found that the procedures were very, very efficient. The total dwell time in the left atrium was 60 minutes in both the paroxysmal and persistent groups. And this included a 20-minute waiting period, as well as any remapping that the operators wanted to do. So basically, the ablation was done in about 40 minutes, which is an incredible difference for AF ablation.
And
Furthermore,
put that into context for us, Atul. What's it ordinarily take?
yeah, so a normal AF ablation, if you're using, let's say, a cryo balloon, would be over an hour. And if you're using point-by-point radiofrequency, that can be up to an hour and a half or 2 hours. So we're talking about a substantial difference in procedural time.
And how about effectiveness, efficacy, durability results?
Yep. So we did a 12-month follow-up. It was a very rigorous follow-up. All the patients had trans-telephonic monitors looking for arrhythmia recurrence. Greater than 30 seconds was counted against the efficacy endpoint. And we found that in the paroxysmal group, we had a success rate of about 66%. And in the persistent AF group, we had a success rate of about 50%. And so putting that into context, those are very similar results to what we would get from radiofrequency or cryo. And in fact, if we only count arrhythmia recurrence, because there were actually multiple ways to fail the primary efficacy endpoint, for example, repeat ablations, changes in antiarrhythmic drugs, we actually see a success rate of about 70% in the paroxysmal group and more than 60% in the persistent group.
So what are the next steps? Where do we go with this technology? Is it ready for prime time, FDA approved? What would be next?
Yeah, so I just wanted to briefly mention the safety results.
Oh, sure.
0.7% serious adverse event rate. That is one of the lowest adverse event rates for cardiac ablation for AFib ever. So very impressive. No phrenic nerve injury, no esophageal damage, no pulmonary vein stenosis, and a very, very low rate of asymptomatic cerebral emboli. So
Wow.
amazing results there.
What kind of number would we see, with radiofrequency ablation?
For complications, yeah.
Yeah.
So there we're usually seeing about 2 to 5%
Wow.
for thermal ablation. So this is again a substantial change. So I
Wow.
think this is the game changer technology. I think this was an FDA trial. I think if you ask me to speculate, I think it will get approved. And once it's out there, I don't see the EP community turning back in terms of adoption of this.
Well, with that kind of safety and with that kind of speed, it seems like a no-brainer. So Well, congratulations. Still look forward to seeing the results that are going to be published simultaneously.
Yeah, so there'll be a simultaneous publication in circulation.
Great. Well, congratulations to you and your community. Sounds like a great advance. Thanks for joining us, and thanks to all of you for joining us here live from ACC 2023.